Alright, hi, my name is Haley. I'm your student nurse today from the University of Southern Mississippi. I'm going to be inserting an NG tube. So basically what this is going to do, it's going to go through your nose, down your throat, into your stomach, and it's going to be used to get you nutrients and the medications that you need. So first, before I start, can you please state your name and date of birth for me?
Amanda Dr. 4799.
Alright, and that matches with my EMR, and the order matches for the patient as well, so I can continue. And do you have any allergies?
No.
Are you experiencing any pain today?
No, I'm fine.
Okay. And how's your breathing through your nostrils? Is there one that is better than the other?
No, they're both pretty good.
Okay, so with both of them being good, I can choose which one. So in this time, I would just insert it into the nostril closest to me. So first thing I'm going to do is I'm going to adjust your bed up. Sorry about the noise. Alright, now put the side rail down. Alright, and normally I would have the patient leaning back, and I can't really do that right now, so next thing I'm going to do is I'm going to come and wash my hands, and I'm going to apply clean gloves. And did you have any questions before we start?
No, I don't think so.
Okay, and just to go over some basics, you might feel a little bit of pressure whenever I do insert the tube. It's totally normal. Just let me know if you're experiencing any pain. I would also discontinue the order if the patient showed any signs of cyanosis, they were gagging, or anything was going wrong with that. So next, I'm just going to drape the patient with this cloth. It's going to catch anything if anything does come up or anything falls on it. So now the patient is in the correct position. So now I'm just going to go ahead and I'm going to get my tube ready. I'm going to make sure that the tube does not touch anything else. Right. And before I lubricate the tube, I'm going to come over here and I'm going to measure from the tip of the nose to the ear, and then from the ear to the xiphoid process. Come back, I'm going to go ahead and mark my tube. Now I'm going to lubricate the tip of the tube about 2 to 4 inches. It's just going to make inserting the tube a lot easier. Alright, so now I'm going to come back over here and I can begin inserting the tube. So I have the patient laying back. That way I can observe the pharynx. So I'm just going to, sorry about that, insert the tube. And once the tube does reach the pharynx, I would have the patient lean forward, and the patient's just going to be taking deep breaths. All right, and now that I've reached my mark, I can let go of the rest of the tubing. I can grab my tape. I'm going to tape it to the patient's nose and make sure everything is secure. I'm going to wrap the tape around. And at this time, I would also tape the tube to the side of the cheek and also pin it to their gown. That way it prevents the patient from really seeing the tube, aggravating them, and they won't be able to pull the tube out. And then I would also send my patient off to x-ray to ensure that the tube is placed correctly. If I did not have the option to send the patient off to x-ray, I would just aspirate the stomach contents and check the pH. And so now that I've gotten the patient back from x-ray, the tube is placed correctly, I can go on to my med administration. So with this, I'm just going to be checking with my EMR to make sure I have the right medication for the right patient, right dose, route, and time, and everything does match up. So that means I can go ahead and continue to administering the medication. So I'm just going to get my syringe out with my saline solution. So I'm going to drop some normal saline. I'm going to come and I'm going to flush the tube. Now that the tube is flushed, I can drop my medication. I'm gonna come back and get some more saline and flush the tube again. All right, now that the medication is administered, I would clean up and I would leave the room, but I have an order that says that the NG tube has been discontinued. So first thing, I'm just gonna check with my patient, and can you please state your name and date of birth for me?
Amanda Deer, 4799.
All right, so the name and date of birth matches with my EMR. My order matches to discontinue the tube. So now I'm gonna take the tube out of the patient. So you might feel a little bit of pressure with this, but it should be pretty easy and painless.
Okay.
So I'm just gonna take the tape off. Great. Take the tube out. Right. Now just discard the tubing. Alright. Are you experiencing any pain or anything?
No, I'm fine.
Alright, so your nostrils feel good, you can breathe out of them well?
Yeah.
Okay, so the patient's doing good. Is there anything you need me to help you with before I do leave?
No, I don't think so.
Okay, so now I'm just gonna put the side rail back up. I'm gonna lower the bed. Sorry about the noise again. All right, now that the bed's lowered and the side rail's up, the patient doesn't need anything, so now I would just go on to documenting my information and I would be good to go.